First, introduce myself. Hi, I'm Morgan. I'm going to be your student nurse today. I'm going to do hand hygiene. We need to do an IV on you, so I'm going to go ahead and get started with that. So I'm going to go ahead and put on my gloves, and I have already pretty well prepped my materials that I'm going to need. Okay, so the first thing I'm going to do is open my J-loop and go ahead and flush it. But I'm going to make sure that it stays in the package so there's no contamination to the side that connects to the IV. And then I'm going to go ahead and flush it. Okay, the next thing I'm going to do is I'm going to go ahead and find a vein I'm liking that I'm comfortable with sticking. Okay, so I think that one looks okay, so I'm going to go ahead and apply my tourniquet. I'm going to apply it higher up on my arm, that way I can move down if I need to. Okay, I'm going to make sure I can still find that vein okay and that it still feels like the one I want to use. Okay, and then I'm going to take my chlorhexidine and I'm going to clean the spot where I plan on inserting the IV, and I'm going to start in the middle and go in outward motion, pushing away any bacteria from the insertion site. And then I'm going to let that dry for 15 to 30 seconds, making sure I don't fan it so I don't introduce any kinds of bacteria or infections. And then once that's dry, the next thing I'm going to do is open my needle and make sure the catheter moves, and I'm going to make sure it is facing bevel up, and then I'm going to find where I cleaned and make sure I don't touch where I plan on inserting it so I don't contaminate it. I'm going to go in at a 15-degree angle, and I'm going to level it out, and I've seen a flash, so I'm going to go ahead and advance my catheter. And once it's advanced, I'm going to hold it in place. I'm going to retract my needle, and I would immediately put that in the sharps. So the next thing I'm going to do is attach my J-loop, and I'm going to make sure it's unclamped. I'm going to pull back and make sure I still have blood return, and then I'm going to flush. And then I will disconnect my J-loop, and I would put a green cap on it to make sure it did not get contaminated. And then to secure it in place, I would take some tape and secure the J-loop, and then I would take the techoderm and place it over the insertion site and label it with my initials, date, and time it was inserted. And then if I wanted to remove it, I would go ahead and pull off the techoderm and the tape securing it, and then I would take a gauze and I would apply it to the insertion site holding slight pressure, and then I would slowly and steadily remove the IV and tape it and hold pressure there for about 15 to 30 seconds. That's all.